Okay, good morning, ladies and gentlemen. Welcome. It gives me great pleasure to welcome you all to the Wellness and Health Innovation Independent Assistive Living Conference. In sponsorship, we've got the Digital Communications KTN sponsoring this event today, and it's a pretty full agenda, as you'll see from the list of speakers that we have for you. So it's a pretty full-on day. So let me just get started by talking about why independent assistive living is getting so much attention and is promising big opportunities for Scottish businesses. The healthcare and health system as we know it today is unsustainable for a number of different reasons. Some are political, most are economic, with the burden of things like the ageing population, the increase in long-term conditions. The health system and services that we see today will have to change, and it's a massive challenge, not just in a local perspective but on a global perspective. One MP 2 years ago actually stated the demographic shift is as big a problem as global warming. In the Western world, in the next 5 to 10 years, we're about to see the crossover. And that crossover is that we'll have more over 65-year-olds than we will have under 5. Now that puts burdens on the healthcare system, but also puts burdens on the workforce and the amount of money that is actually going to be ploughed back in to keep healthcare systems and services alive and buoyant. Long-term conditions like heart failure, diabetes, dementia is certainly on the increase, and there's a real opportunity to look at these conditions and try to develop better systems, services, products, applications for these conditions. 75% of the NHS's budget at the present time is spent on treating conditions, and the picture that needs to move to is actually around preventing and allowing people to live independently for as long as possible. And that's not just independently within their home environment, that's actually independently within the community. The ageing population don't want to be stuck in their living room watching television all day. They want to have a good quality of life. And I suppose the challenge for all of us is how can we support and develop products and services that will actually help that population. The Wellness and Health Project has been going for 9 months, and one of the big questions that we get asked is, well, who will actually buy these products? A lot of concern is if we develop them, is there the budgets to actually buy them? And what we're finding is that community health partnerships have budgets. Countries around the world are investing in independent assistive living. Local authorities have some budgets. So there is pots of money around, and there is talk of hopefully increasing pots and decreasing pots as the constraints politically. But one area that we see some light in the future is potentially the consumer, because the consumer will potentially have the power to buy products to actually allow them to live more safely, more securely and more confidently within the community. So we're actually predicting that there will be a consumer pool. It's hard to put a time on when that consumer pool will happen, but companies like Boots Innovation are very interested in this market sector. So we're thinking that you potentially would find some of the tools for independent assisted living actually appearing on the Boots retail shelves. Care homes is another one, and I know that there's some care home representation here today. Care homes are looking to increase efficiency, and they're looking for technologies that will help them do that. Insurance companies, when we talk about prevention and we talk about actually assisting individuals to take ownership of their own life and their own lifestyle, then insurance companies have got a great interest in the prevention market, because if they can keep you healthier, it means that they pay out less later on. We also see businesses and the workforce As you'll have seen from my graph earlier on, we have a declining workforce because of the throughput in the future. So it'll be very important for businesses to keep their workforce healthy. And already we're seeing a lot of occupational health services and products go into the workforce environment. The Wellness and Health project is commissioned by Scottish Enterprise. We strongly believe that Scotland has got the skills and the expertise to take this opportunity on and to look at innovating around this market sector. There's already companies in Scotland that are doing it well, and what we need to do is encourage and support companies that are wanting to come into this marketplace. And the Wellness and Health project is put in place to do that. We support in three main areas. We give market intelligence, market research, we help with the product technology and innovation, and we also do business development, which is very much introductions and routes to market. There's no point in small companies producing products if they don't have the right introductions and the right route to market.